Now, to address this, last year we published a paper that involved a significant amount of work in trying to reclassify these, and we ran literally hundreds and hundreds of statistical checks just to see where correlations may exist and looked through our database to try to identify if there were better categorizations. And we came up with this new nomenclature, which is basically the broad category of penile curvature encompasses Peyronie's disease, but it also encompasses non-Peyronie's conditions like congenital curvature, trauma-induced curvature, maturational curve, and these are different conditions. And then within Peyronie's disease, you've got different subtypes as well. You've got men who have a progressive type condition where it gets worse and worse over time or goes on for years. You've got relapsing and remitting, such as like with multiple sclerosis, where someone has the condition for a while, then they don't, then it comes back, or then it worsens. And then you've got calcifying, which is definitely a distinctive type of Peyronie's. And then you have classical that basically doesn't fall into any of those normal categories, which is the overnight curve, and it stabilizes and it's there and it's just present. And then on top of that, you can have a trauma component either here or here, because if you cut yourself, you get a scar. And if the penis gets injured, you get a scar. But that doesn't necessarily mean that it's Peyronie's disease. It could just be a normal scarring type condition. Now, when you look, and this is a busy slide that just shows that red means that it's different from other conditions. And so you can see when we categorized all these different subtypes, you get a lot of red popping up here. So a lot of statistically significant differences compared to men who don't have that subtype. And it basically highlights that these are indeed distinctive groupings. So we see these kind of diagnostic clusters, which demonstrate these distinct disease patterns. Now you say, well, who cares? That's good information and everything, but why do we care and why is this important at all? And part of the reason here is that the natural history of all these conditions is very, very different. If I go back a slide and look at this progressive versus classical versus calcifying and so on, all of these men are going to behave differently long term. So as a provider and as a patient, you want to know, well, what's going to happen to me? What kind of treatment should I use, and so on. And this information that now allows us to classify these men better goes a long ways to starting that process of providing better information.